Okay, hello. So I want to talk about something very crucial, especially when it comes to pregnant women and cesarean section. So here is what I saw on Insta blog. Yes, a man was lamenting what he witnessed while in the hospital, how two women, their husband refused to give consent. One lost her life and the other one lost her baby. So let me read. He said, I've been at the hospital for some days over a minor fever and I've witnessed two maternity deaths. First case, the doctor advised the husband to go for CS, but he refused and said, since her due date is in 2 days, let's wait. So he left with the wife only to return few hours later with a pregnant woman bleeding. She was rushed in for CS, but she passed away. Secondly, he said, I don't know the situation of the child. The second case, same CS advice, but he ignored. Tragically, the baby passed away in the woman's belly and they had to use CS to remove the lifeless baby. You could feel the tension in the hospital towards the stubbornness of both husbands, but there's nothing they could do since they can't forcefully operate on the woman without the husband's consent. Now, I want to let every woman or every pregnant woman to know that you have the right to give your consent. You are the one to consent if you want to go for cesarean section or not your husband. Your husband only comes in when you are in a situation where you can't grant the consent. If you are in a situation where you are unconscious, somebody, a significant other or a close relative can give consent. But if you're conscious and alert and active, you have the right to give consent. I'm working in the hospital and people give consent for their surgery. So where is this the husband didn't give consent coming from? Like the first case scenario, he said that they walked in, he walked in with his wife. That means the woman is conscious, alert, and active. Unless when it comes to finances where you are dependent on your husband, maybe he have cajoled you or made you to believe that he doesn't have money for the CS. But when it comes to consent, giving consent, you are the one to give the consent and not anybody. As long as you are healthy, you are active, you are conscious, you are alert, you are the one that will give consent. You are the one that will sign. You will sign. They give it to you. Even in the surgical unit, any other surgery, for instance, maybe let me take for instance, you have a appendicitis and they want to operate on you. Is it not you that will give consent, or would you rather wait for for the appendix to rupture? Will you prefer it to for you to have a ruptured appendix before you give consent for them to operate on you? So it's in cesarean section. And by the way, what's the fear about CS? CS is also a life-saving strategy. It's a life-saving, you know, thing for a woman, especially when the woman is in danger. For a doctor to tell you that, okay, we are going to operate on you, that means he has seen that you really need that operation. Of course, natural birth is always good, but when they tell you that it's better you go for an operation, then think towards it. Think towards it. Then ask questions. Is your right? Ask questions. Ask the doctor questions. He will explain to you. Is your right? Before you sign consent, the doctor have to explain the surgical procedure, what is involved, the risk if you refuse before you go. So don't be ignorant. That is why we are here. We're always talking on the internet so that you learn and don't fall victim. It is you that will give consent when it comes to your oppression, unless you are in a state where you are unconscious. You can't even talk. You are in a state where you can't give the consent. Then your husband or somebody, a close relative, can give it. But when you are conscious and alert, you have the right to give consent. That is why it's good for women to be saving up. If you're pregnant, start saving, no matter how little. Even if you are a housewife, be saving little by little because you don't know how the pregnancy will end up. So that you will not be looking at somebody to take decision over your own life and that of your baby. Remember, we are talking about 9 months. 9 months. And at the end of the day, because somebody or you want to listen, you have the right to give consent. It is you that will give consent. Unless in a case where you can't, then your husband or a close relative can give consent. So let this, sink, and so that women will not be thinking that it's their husband that will give consent. When you go to hospital, please ask questions. Ask your midwife, ask the nurses, and ask the doctors this thing I'm talking about. Okay, so see you next time. My name is Nurse Valerie. I'm a registered nurse midwife. So I talk about pregnancy, labor, and delivery. So don't forget to like and follow. See you next time. Bye.